Most people think of core training as working the rectus abdominis, or what we like to call them, the six-pack abdominals. This muscle group, however, serves a limited function for performance, as it only helps you flex and stabilize the trunk in one plane of motion. From the most basic form of human movement, such as walking, to more advanced activities, such as sprinting, our body has to rotate. We are mostly designed with synovial joints, or joints that are responsible for helping you move in all planes of motion: flexion, extension, side bending, and rotating. Abdominals, such as the transverse abdominals or the internal obliques, help you in rotation and play a major role for maintaining proper posture during movement. Your transverse abdominis, which is your deep core muscle that wraps around the entire trunk, helps you increase intra-abdominal pressure and is a major stabilizer of the spine as we exert force and as we rotate in and out of extension. This muscle is on the same neurological loop as the pelvic floor muscles. So if the transverse abdominis is not working properly, neither is the pelvic floor. Internal and external oblique muscles are important for side bending and maintaining proper position of the rib cage and the diaphragm muscles while we're moving side to side. Obliques are known as respiratory muscles that assist in forced expiration. This muscle group is vital for maintaining proper posture in dynamic movement. Know that these muscles aren't technically abdominal muscles, but they have a significant role as synergists with the abdominal muscles to help them function properly. The diaphragm muscle, which is our breathing muscle, works hand in hand with the transverse abdominis and the oblique muscles in respiration. As you breathe in, the diaphragm muscle will determine the function of the abdominal muscles. These muscles are dependent on respiration, and without proper breathing, we cannot create intra-abdominal pressure. We cannot move oxygen to other working areas. In other words, we lose the ability to stabilize ourselves as we move. Another important muscle that mostly no one talks about is the tongue. I know that sounds a little weird, but the tongue is a big factor in stabilizing the neck and core during respiration and all movement. So the tongue muscles attach on the mandible and hyoid bone and are interconnected with the neck flexor muscles. Having proper tongue position is essential during any activity, and the tongue should rest on the roof of the mouth just behind the teeth. Proper tongue position helps you stabilize the neck during movement, and if the tongue does not sit in a correct resting position, the neck flexor muscles will become overactive as you breathe, promoting forward head posture. Paul Chek, author of Scientific Core and Conditioning and founder of the Chek Institute, talks about this in his material. So just think of the tongue muscles as the abdominals of the neck. So to bring it all together, what do all these muscle groups have in common? Well, they all aid in respiration, postural control, and stabilization. When you exercise either endurance, power, or strength training, the demand for postural control will increase.
One of the most critical factors to train these muscles conjunctionally is by maintaining an optimal zone of apposition of the diaphragm. The zone of apposition, or ZOA, was a term made popular by the Postural Restoration Institute, which describes the area of the diaphragm muscle shaped like a dome or umbrella, which corresponds to the other portion, which is directly opposed to the inner aspect of the lower rib cage. The ZOA is important because it is controlled by the abdominal muscles and directs diaphragmatic tension. As you breathe in, the diaphragm muscle contracts concentrically, as the abdominals contract eccentrically. As you breathe out, the diaphragm contracts eccentrically, and the abdominals contract concentrically. Without an optimal ZOA, the abdominals become chronically long and weak, adding tension to the lumbar spine, which will cause a cascade of negative effects in your posture.
The first negative effect of not having an optimal zone of opposition is inefficient respiration, which means less air in and less air out. This limits your ability to create pressure. The second effect is diminished activation of the transverse abdominis and oblique muscles, which are important for both respiration and lumbar stabilization, as mentioned before. At Breakthrough Sports Performance, all of our abdominal training will incorporate respiration. We understand that without a proper ZOA, abdominal training will become less effective. Both maintaining a ZOA and training your abdominals go hand in hand, and much is true with any form of movement. Without a ZOA, we are very much less effective as human beings. So here are a couple techniques that we like to use from the Postural Restoration Institute that will help you develop and maintain a ZOA and abdominals as well.
This first exercise is entitled Supine Supported Straight Leg Raise with Alternating Crossovers. So you're going to lie on your back flat, perform a slight pelvic tilt. You're going to take a deep breath of air in, pull that heel back into the mat, and reach your opposite hand to the toe. You're going to hold this position for 4 to 5 breaths. Maximize the exhalation and try to maintain the reach position as you inhale. Do not breathe into your belly. Feel your ribcage expand as you inhale. With the leg that straightens out, do not bring the knee closer to the hand, and that hip should not flex more than 90 degrees. Concentrate on reaching the other arm to the opposite foot. When you breathe in, keep those abdominals engaged, and when you exhale, blow all that air out you possibly can. This next exercise is entitled Standing Serratus Squat. So you're going to stand facing a wall with your feet shoulder width apart, pointed forward. Bring both elbows to shoulder level. Bend both arms at a 90-degree angle. Keep your palms facing each other and push your elbows into the wall. Keep your elbows pressed into the wall. Do a slight pelvic tilt, retract your rib cage, and keep your eyes up towards the ceiling. Make sure you don't sway into the wall during this exercise and raise your heels off the ground. You want to make sure that your belly button's drawn in and you have a slight pelvic tilt. Without letting your arms move, continue the squat until your knees touch the wall. Do not let your heels come off the floor, as mentioned before. You should feel the muscles underneath the shoulder blades engage and the muscles in front of the thighs engage. Hold this position as you take 4 to 5 deep breaths in through your nose, out through your mouth. Attempt to fill or expand your upper back with air on each inhalation. Relax and repeat 4 more times.